Ladies and gentlemen, welcome back to the True Life Podcast. I hope everybody's enjoying their Sunday. It's either the first day of the week or the last day of the week. I'm not sure, whatever you want it to be, but I hope it's beautiful for you. I hope the sun is shining, the birds are singing, and the wind is at your back. I got an incredible show with an incredible guest who's doing some incredible research. I want to introduce to everybody the PhD candidate, Aleksandra Wingert. Aleksandra is a dedicated, enthusiastic neuroscientist, demonstrating a profound passion for the fascinating realm of psychedelic research, neuroplasticity, and human sexuality. Graduating with distinction from King's College London, where she earned her Master's of Science degree in Clinical Neuroscience, Aleksandra currently stands at the forefront of groundbreaking research as a research assistant and clinical coordinator at the renowned Center for Psychedelic Research at Imperial College London. Aleksandra's academic journey has been marked by a relentless pursuit of knowledge and a commitment to expanding the boundaries of our understanding of the human mind. With a robust foundation in clinical neuroscience, she has seamlessly transitioned into the dynamic world of psychedelic research. Over the past 5 years, she has honed her skills in both clinical and laboratory research, cementing her status as a promising emerging scholar in the field. At the heart of her research portfolio lies the Microdosing 2.0 project, a pioneering venture that has captured the imagination of both the scientific community and the general public. Her dedication to pushing boundaries of knowledge and her innovative approach to research have culminated in the publication of multiple influential articles in high-impact scientific journals. Recognizing her exceptional contributions, Aleksandra received the prestigious BAP Summer Project Award for her outstanding work at the Center for Psychedelic Research. Her thirst for knowledge knows no bounds, and she seizes every opportunity for growth, embodying the spirit of lifelong learning and personal development. Thank you so much for being here today. How's it going?
Thank you so much. Wow, that was that was such a wonderful introduction. So many positive things. Thank you so much for putting this together, and thank you so much for inviting me. It's such a privilege being here and having an opportunity to talk about my research interests with you. And as you know, I was a little bit hesitant at first to join the podcast because being in such an exciting place in the field at the Center for Psychedelic Research and working with such a brilliant, interesting minds, although it's super exciting, it also might make you feel a bit self-conscious. And I know that I still don't find myself an expert in the field. And, as I'm trying to grow and learn more every day, it's definitely an exciting opportunity for me to grow as a scientist. But yeah, it's definitely exciting times to be in the field and talking to you right now. And I'll try to just show you my perspective of how I see psychedelic research and the research I've done so far. But by no means, I want to say that perhaps I'm not still an expert in the field. So
Well, thank you for that. It's interesting to think about the idea of who we are, where we're at, and what we're accomplishing. It seems to me that so many people, regardless of what field you're in, whether you're a mechanic or a researcher or a truck driver or a swimmer, wherever you are in your life, you're listening to this, you often do some of the greatest work while you're at this stage. A lot of the times you'll hear people in the military talk about being in the trenches. And it seems to me that that is where the war is either won or lost, is in the trenches. And I think that people that get up and are in this state of not knowing, am I an expert? Am I a novice? Look, you're in the trenches and we're all here together and we're all here fighting. So I'm glad that you find yourself in this position. I'm sure that, and I'm hopeful that everybody accomplishes what it is they want to accomplish. But being in the trenches is a badge of honor, and it's something that helps propel the people behind us into the world of expertise. When they see us fight, when they see us begin to gain knowledge, we are showing them the way forward. So I think it's a beautiful place to be, and I'm excited that you're there. So thanks for that. Maybe we should jump into, what are you doing in the trenches these days? What is this Microdose 2.0 project? Do you want to give us a background? However you want to start, go ahead.
yeah, of course. Well, thank you so much. Thank you for the brilliant introduction. As you mentioned, I am a PhD candidate at the Center for Psychedelic Research, and my main focus for the PhD is actively coordinating the Microdosing 2.0 study. Some of the people in the audience might already be familiar with the first microdosing study that has been done at Imperial College London, which is a citizen science double-blind microdose study, and it was fully online. So we have a few differences, and there are a few reasons why we decided to do part 2.0. So let me maybe start explaining the study design and why we designed the study in this particular way, and then I'll give a little bit of kind of differences, what we did in the past and what we're going to do now. So as I mentioned, it's a double-blind citizen science study where we're looking for people who are planning to microdose with their own substance, their own initiative, to help with their mood problems and perhaps depression. It might be subclinical levels of depression. They can also have a diagnosis. It's not an exclusion. However, we do exclude people that are currently on antidepressants or any mental health medication because, there still might be an issue of the interaction effect. We still don't know if it's entirely safe to use psychedelics as well as SSRIs. So there is a long debate. So to make it as safe as possible, we have to have a bit of a stringent inclusion criteria as it is with the majority of psychedelic trials. So the tricky part is that we kind of have to rely on people to be kind of honest with us and willing to participate in this research just to contribute to the development of the field. And kind of follow the procedures we have in the study. We have a quite interesting self-blinding procedure where we, when we allocate people to a certain placebo or microdose condition in a double-blind manner, so both us nor the people, they don't know whether they take the microdose or placebo, and we kind of support them on how to allocate those capsules using little QR codes. And it's an interesting concept, and it's definitely a lot to explain, so I'm not going to go into a lot of detail about it. And so we are planning to recruit 60 people, at least 60 people, to participate in the study, which is quite a large number. So I hope I'll manage to achieve that in the next 2 years, and we'll be looking into some psychological outcomes like, for example, depression, anxiety, as well as physiological outcomes such as heart rate variability or changes in sexuality. Perhaps we also look into sleep. We'll be giving people Oura rings during while they participate in the study to look into the heart rate variability, which is quite interesting to measure because most studies so far only focus on the psychological side of mental health outcomes. But myself, I'm quite curious about how the physiological side will also perhaps change. And as we've been seeing a lot of placebo effect in, different various microdosing trials, I would be quite curious to see whether if people do improve potentially in the placebo group, would that psychological improvement also be similar to the physiological improvement? And if yes, then, what does it mean? And perhaps this study might not be able to give us any conclusive evidence. We still don't know. At least it will give us some sort of more indication of what's going on both psychological and physiological level. So basically the difference between the first study and this one is that the original microdosing study was only fully online, so people only did psychological surveys and some cognitive testing, while we also have a laboratory measure in the lab branch of the study. So we'll be looking into various markers of neuroplasticity using electroencephalography. We'll be looking into BDNF levels in the blood and also some epigenetic markers of immune response. So I think it's a very exciting study. And something also important to mention is that the reason why we designed the study to be kind of citizen science and do it at home design, it's because we see with those very well controlled clinical trials that people are not necessarily finding a lot of effects with microdosing so far. Like, for example, people in anecdotal studies report a lot of benefits. However, those studies are typically not placebo controlled and rely purely on the self-report measure, where people have a lot of expectancies. And as you go up into scientific rigorous hierarchy, the less kind of positive outcomes you find. And we're going to show that in the literature review that will hopefully be submitting quite soon. We're still working on it. It's quite an exciting project. So we postulated that perhaps microdosing, it's something that kind of emerged originally on the streets, and perhaps that comfort of doing it at home, but also with a proper placebo measure in place, could give us a bit more understanding into the whole microdosing paradigm. But also because we're going to include a sample that already has some mood affective disorders, hopefully it will give us more indication whether microdosing has any therapeutic potential or not, because so far most clinical studies that have been done included populations that are extremely healthy. So we might be seeing so-called ceiling effect of well-being. So it would just be interesting to see whether this will be similar with people that already have some levels of, mental health problems and perhaps have a little bit more room to improve as they would with antidepressants, So
Yeah. It is fascinating on so many levels. And it seems to me like there's a lot of things happening with this study. One thing is this introduction of citizen science. I think that not only is the idea of microdosing pioneering in a way, but so too is this idea of citizen science. Like in some ways, it seems to me that this study and other studies like it are beginning to try to get their hand around other variables, like the citizens out here. Like, how do you measure this other group that's not controlled? Like, I think it speaks volumes of our ingenuity and our curiosity and our ability to thoroughly understand when we start going out and finding tools to measure that. Like, that's a step up for science. Let's include these people. Let's take it out of the room and put it into the real world. And I realize there's liability for that, but maybe you could talk a little bit more about the citizen science aspect of it. Like, how did that come to be? Were you sitting around a table with people being like, I think we should move this over here? Or is there anything you could speak to? I know you're limited in some things, however, but maybe you can speak to the idea of citizen science.
Yeah, of course. I think it's a very interesting concept and quite important for you to mention that. And I have to emphasize that the citizen science concept that will hopefully work in this study might not exactly be applied to using large doses of psychedelics just because of the safety and the preparation to the experience. Like, for example, obviously we wanted to focus on the safety of psychedelic therapies, using them in individuals, and the elephant in the room is still using it with people with various mental health problems. And by introducing the citizen science design, it's great because we definitely limit the cost of the clinical trial and we can include a larger population. However, we still have quite stringent inclusion criteria for the trial. So we do have a psychiatrist working alongside that will make sure that the people we recruit are, it's safe for them to participate in those trials, if that makes sense. So although I think the concept would work for microdosing per se because it's something that kind of emerged from the street, I'm not sure if I would definitely agree that it's something that should definitely be used with trials that use perceptual doses of psychedelics, because it's super important to have a good preparation. It's super important to have perhaps therapeutic support there. It's super important to know how to integrate this experience. And I think without previous preparation, if people that are psychedelic naive, that might be quite a scary experience. So yeah, it's tricky.
It's very tricky. But such is the nature of science, you know. And as you were talking about this, I started thinking, how could you possibly come up with a placebo for a medium dose psychedelic? Like, there's just like, there's no way to not know. I heard people using niacin for maybe a smaller dose where you would get this flush or something like that. But even that, if one is familiar with both substances, I think it's clearly easy to distinguish between them. But is that a subject that came up when microdosing? How do you come up with a presentable placebo for that?
That's a really good question, and I'm not sure how much I can
Yeah.
reveal about the study.
Sure.
So, we had a long discussion about how do we do the placebo measure, and it's definitely something that is a big issue in psychedelic trials. And even last time, we submitted a paper with my supervisor to one of the journals. We got a little bit of critique. It was a paper about using of ceremonial ayahuasca, and it was a data analysis. And one of the reviewers mentioned that, it's critical, that it's really difficult to have a proper placebo measure in psychedelics. And of course, it's such a big challenge. But how exactly that will be executed in the future, I'm not sure. Perhaps when psychedelics when they are kind of like, approved treatments, hopefully we won't need the placebo measure anymore. Regarding the microdosing study, yes, it's also tricky, because in theory, microdosing should be sub-perceptual. Whether it's actually sub-perceptual for most people, it's really hard for me to say about it, because everyone has a different experience with microdosing. Everyone has certain expectancies, about participating on the trial. Some people believe it. Some people think it's a placebo effect. There is a lot of, discussion in the topic. And originally, in the first microdosing study, Bala Shigetti, who kind of designed the study, used for people that use magic mushrooms, the placebo that he suggested using was chaga mushroom powder. Originally, we're supposed to also use the chaga mushroom powder in a design of our study. However, because we will be looking into some biological markers, like the BDNF levels, we're quite cautious about the choice of the placebo, because there is some limited evidence suggesting that perhaps using those other, adaptogens, like lion's mane, chaga mushroom powder, might be enough to kind of boost your genetic and immune system response to a level that might be a confounder in the study. So we really tried to focus and did a bit of research of what substance can we use to make sure that the tablets, that the capsules for placebo and microdose group look and weigh exactly the same for both conditions, so people cannot distinguish between them. But also we had to use something that will not potentially cause any confounder changes. So in the end, we decided to go with a vanilla rice protein powder. And for people that are using LSD, they're just going to use a plain blotter paper as a placebo measure, just to make sure that the tablets weigh and look exactly the same. So yeah, it's definitely a tricky concept. And I think for the purpose of scientific research and this study, we wouldn't really be able to use any active placebo, because it's such a confounding factor. And if people in the placebo condition improve, then it would be really hard to say what is attributable to this improvement, especially on a molecular level.
Wow, it's fascinating. It's an interesting question to take in, and I'm often as a non-scientist, it's mind-blowing to me to get to read the research of the mechanism of action and the way how deep it goes and what we learn and what we don't learn and stuff. But also as a non-scientist, I begin to wonder, why do we got to know the mechanism of action? Like if it works, like why do we got to know if it really connects to that TRKB receptor, or like what is the greatness that we get from really understanding the mechanism of action, do you think?
Hmm. It's definitely a very, very interesting question. Hmm. I do think it's important to understand the
Sure.
mechanism of action because, everyone is different. And can you really say that one substance works the same for all? I wouldn't be so sure, even though, antidepressants have been used for people with, for example,
Right.
SSRIs has been used in people with depression for millennia. Like some people are still treatment resistant, they still don't react the same to those antidepressants, so I think it's very important to understand the mechanism of actions because perhaps we can focus on optimizing
I
what
love
we
that.
have. And also there is a matter of side effects. It's really hard to, like, the way our brain is wired is so complex and there are so many interactions, and often interactions lead to side effects. So I think the ultimate goal of mental health and any type of drug research is to come out with something that is the most effective as possible and also causes the least side effects as
Right.
possible. So in order to do it, we constantly evolve, we adapt even throughout lifetime. Our body changes. We have some hormonal changes, and it's really difficult to find one substance that works for all. So I think that's why it's important to be a bit more creative with how we look at drugs and targets
Yeah,
and receptors. So yeah.
it is. It's wonderful to contemplate and think about, and it must be it must be rewarding and interesting to be on the forefront of change. Like in a previous conversation, you and I had spoke about it's very competitive, but it's also very rewarding to be at the forefront of change and studying this. Like how do you navigate this current world of psychedelics that we're in?
Yeah, it's definitely it's definitely exciting to be in the forefront of the change, and the field is now opening so much. It's constantly evolving, and we have some groundbreaking research going on, large studies
Yeah.
investigating the potential of psilocybin for treatment resistant depression. We had some exciting results from the MDMA trials, which are definitely such a big revolution, but there are also challenges coming with it. And it's quite difficult to navigate, especially for
Right.
scientists that are trying to, pursue it and learn to navigate the field. Like, first of all, academia, it's extremely competitive, and psychedelic research is no exception. So funding sometimes can be limited. So
Right.
even if you have this wonderful idea of, investigating a concept, you might not have in practice enough money to do it. And even if you do find enough money, there are some ethical consideration of how you look into that question, if
Yeah.
it's safe to look into it, and the methods you use, and also the whole regulatory side is also quite tricky. It's not easy to get approval for a clinical study. Is extremely challenging, and I think it's a good thing because we really need to focus on ethical standards and making sure that it's safe for us, as safe as possible for us to use a certain substance and investigate a specific research question. But at the same time, it's quite challenging because we have those financial regulatory constraints, and yeah, also the time constraints. It's like people say that the field is kind of sometimes publish or perish. So like sometimes academics are really pressured to just publish a lot of research, and sometimes it's hard to find enough kind of evidence that could be good for publication, and then you have to find a good journal that will accept your publication. So it's definitely challenging, but I think as long as you have your goals in mind and you want to do your research with a good ethical standard, then it's definitely worth it, because it's very rewarding to do this job, and it's definitely very rewarding to see people improve. So yeah, that's the overview, I guess, from my perspective.
Yeah, it's wonderful to me, and I see science changing from the idea that we spoke about earlier about citizen science and maybe the move from journals to podcasts. I'm not saying one replaces the other, but it's definitely a new growing platform where you can come on and speak to the current study you're doing without having, and in a way it's publishing, like you're getting your information out there, but it's restrictive of some of the regulations. Like there's things you can't talk about, obviously, but you can get your knowledge out there and have people reach out to you with more information. So in some ways, you're reaching an audience. Another thing I see evolving too, and I'm curious to get maybe some thoughts on this, if there's any studies or just thoughts, but it seems in the psychedelic community, there's been this sort of wedge between people who administer help. Have you done psychedelics or have you not psychedelics? And it's the same problem with language. It's an either or. But what I see evolving is a both and, like the coming together of both people to sit down and apply the integration. And like that to me, it kind of gives me goosebumps, because the same way we can look at the liar's paradox and say, oh, both things are true, so too might be the world of science and combining the person with the experience and without experience. Like, yes, and both are true. Let's bring them together. And I think that that's going to give us a more holistic approach in that. What do you think on those thoughts? Is that too far out there, or is this something that you kind of see emerging?
Yeah, I definitely feel like it's a bit of a controversial discussion, and I don't know myself where I feel
Right,
about it, and
right,
definitely I'm not an expert, but
right.
from my own perspective and how I myself approach psychedelic trials, I feel like there is a little bit of boundaries that it's definitely needed to
Right.
be put out there.
Absolutely.
And personally, I think I find it hard to talk about my personal,
Yes.
psychedelics.
Yes.
I do understand that it's quite important to talk about it, and especially when you're a therapist. I'm not a therapist; I'm a scientist, but I can see that it's a quite a hot topic right now among psychedelic therapists, whether it's a good or bad thing to for therapists to have previous experience with psychedelics. And I think it's definitely a valid point to discuss. I'm not sure where I personally am on that subject, but I would be curious to see where the field goes and what would be the conclusion of this discussion.
Yeah, I'm excited for the future. I think that there's a lot of cool things happening in the world of psychedelics. And sometimes in psychedelics we think about LSD or mushrooms, but ayahuasca seems to be something that has been at the forefront of change for quite some time, both in different cultures and different things like that. And you have done an incredible study with ayahuasca. Maybe you could talk to us about that a little bit.
Yeah, of course. It's going to be a little bit of a transition now, because I feel like ayahuasca, it's something not, it's something that has been published quite well so far, but it's used in slightly different contexts outside of the Western medicine, maybe. And so I've always been kind of interested in that, indigenous cultures and the
Yeah.
use of ayahuasca. And when I first joined Imperial, I've met my supervisor, and it happened to be someone that is actually ayahuasca researcher himself. So I was extremely, excited about finding the right person to do the research with, and it was such a crazy coincidence. So he's a wonderful person. His name is Brandon Wise, and it's been such a pleasure working with him. I've learned so much so far. But to tell you a little bit more about the study we did, so I personally only did the data analysis side, because the data has already been collected by by Brandon and his supervisors previously in the past, but there's still a little bit of data to analyze. And I thought it would be a good idea to look into traumatic re-experiencing. Brandon also happens to be kind of an expert in PTSD and trauma, so it was definitely a good concept to explore. So we had this sample of 306 just people who are non-veterans that went into South America to participate in ayahuasca ceremonies, but also 33 Special Operation Forces veterans that have quite high trauma profile, and many of them also have PTSD. So how we approach this topic is, first of all, to investigate different types of traumatic events within this population, and we look at of also different subpopulations groups. So, for example, what is the difference in a trauma profile of men and women in the population? Or what is the difference between veterans and non-veterans? And we also look into traumatic re-experiencing. So the questionnaires we use, it's called Leg 5, and it's structured by asking whether you had previous experience and you have a list of traumatic experiences, and then after their experience with ayahuasca, we ask them whether they re-experience certain types of traumatic events they previously reported. And we found that 59% of veterans and 42 non-veterans were actually experiencing previous adverse life events, which is quite a significant number. And what was also interesting is that females generally experience adverse life events in a higher proportion than males, because 57% of females in our population group re-experience previous adverse events in comparison to 32% of males. And just to add, the population was kind of proportional regarding the males and females in the situation in the population to start with. And it's important to say that women exhibited a greater likelihood of re-experiencing adverse life events than men, and it was substantially driven by the differences between females and males re-experiencing sexual assault, with 4 in 10 women with previous history of sexual assault. Obviously, it's a bit of controversial topic, but much more female than male seem to kind of experience the sexual assault, and it's something that has been re-experienced a lot. And also regarding the veterans, it seems that they exhibited a greater likelihood of re-experiencing certain adverse life events. For example, experience of disaster, loss of significant other, and also episodes of harming others. So it does make sense because they also have a different trauma profile than people that are not veterans. But what was actually also interesting is that this traumatic re-experiencing was associated with increased discomfort and reappraisal during the ceremony, which might suggest that perhaps it contributes to some therapeutic outcomes, but is not without challenges during ceremony. And I think that should be acknowledged, that, going into this experience might be extremely challenging. And also, what we found as a caveat, that there was a really small percentage of participants who reported re-experiencing a memory that they did not previously report experiencing at all, which is quite interesting because you might ask yourself a question whether they just forgot, repressed those memories, or perhaps these are not their memories, and how the hell did they experience them if they haven't experienced them in the first place. So I think it's definitely a very interesting paper to look into for anyone that is interested in ceremonial use of ayahuasca in relation to trauma. And it's important to acknowledge that there are differences in populations attending those ceremonies, and perhaps, a facilitator might have, a certain approach to accommodate that difficult re-experiencing that might emerge during the ceremony. So yeah, that's the main gist of our first paper. We also have some future papers planned using the same database, but as I am interested in physiological biomarkers, I would really be interested to investigate the heart rate variability change. And we also happen to have some of this data from wearable devices. And I still don't know whether it's possible to have a good enough signal to kind of stimulate this data and look into it into more detail. But I'll endeavor to try, and I'll see if we can get some interesting results.
Yeah, I think you'll get a lot of interesting results. It's fascinating to me. Is there any working hypothesis on the, I guess, is there any working hypothesis you know about or scientific studies done that speak to the idea of change coming through confrontation? Because it sounds like in that study, people were revisiting these very challenging, traumatic moments. And it sounds like a hypothesis may be something along the lines of the path of confrontation is what leads to the change of reorganizing your thoughts, which leads to health. I'm not sure. Are you aware of any studies like that or people that speak about that?
Yeah, definitely. I'm not an expert in clinical psychology.
Right.
However, I do believe there are different studies talking about it, and also different schools of, therapists say that it's quite important to kind of perhaps re-experience to those memories and kind of shift your focus to that perhaps traumatic event in order to kind of acknowledge it, that is there, and get better. And I've recently read quite an interesting book called Spiritual Bypassing, which talks about how people will sometimes use spirituality to kind of bypass this traumatic and often, forgotten, or trying to desensitize that the emotions they're struggling with, and how people can use spirituality to kind of bypass this experience. And the author of this book, it's definitely an interesting read that I would recommend, is kind of, emphasizing that it's very important to kind of try to acknowledge those difficult emotions in order to get better. So I do believe it's definitely a valid point. And it seems that we also looked into adverse life experience, and it seemed that this traumatic re-experiencing was associated with increased discomfort and reappraisal. So yeah, I think there is definitely a lot more research to be done, and I would be curious whether that will be a working hypothesis one day.
You had mentioned that perhaps in a future study you would like to monitor like the heart rate. It seems to me like that heart rate would increase with those traumatic experience. And if it did, what would that tell us? Like, what would that mean?
It's not exactly heart rate
Okay.
that I would like to look into. The variable is called heart rate variability. Heart rate variability is kind of reflects a measure of the interbit intervals in your heart rate while it's beating. And there is some evidence suggesting that people with depression might have decreased heart rate variability, and that, the more flexible your heart is, the healthier you are. And often people that do a lot of physical activity and are generally healthy, they seem to have higher heart rate variability. So I would like to investigate whether, and I know that my colleagues also investigate heart rate variability. It seems like quite a hot topic now. But yeah, I would just be curious to see whether we could make a similar kind of hypothesize that people with PTSD perhaps have lower heart rate variability similar to depression, because it's also on the spectrum of psychopathology, and probably also suggesting of physical pathological levels, like the way your heart works, the health of your heart. So I would be curious to see whether perhaps there is any change we're going to see after the ayahuasca trip, or perhaps during the trip. And yeah, similar to what we're going to do in the microdosing project, we'll also look into heart rate variability, because we expect our population to have some levels of subclinical mood problems. So we hypothesize that those people will have a lower heart rate variability than healthy people, and we're going to look into potential improvements while they're on microdose, and also on the follow-up, which happens after the microdosing period, so 4 weeks after they complete the microdosing period. So we're not only going to look into whether there's any potential change in heart rate variability, but also whether this change can be a long-term. And yeah, I think it's quite interesting.
It's fascinating to think about. So you would get the results back from that and then measure it against, what would you measure it against? Like healthy beings in different studies, or what would you measure that results against?
Yeah, that's a good question. So firstly, we could just simply focus on pre and post changes. And also, as you know, we're going to have the placebo group in the
Right.
study. So we can also compare if people in the placebo condition could also improve in heart rate variability. But it would be also difficult to say whether this change, if there is any change, if it could be attributable to just the drug, because there is evidence suggesting that even improvement in your lifestyle, in a level of physical exercise, can also contribute to that positive change. So whether we can hypothesize that this change is definitely attributable to psychedelic or not, it's really hard for me to say. But maybe we could look at heart rate variability as a potential biomarker of mental health and also physiological health change. And if yes, I think it's definitely a great and interesting biomarker to have, because it's completely non-invasive how we measure it. But I'm not sure whether wearable devices will be good enough and accurate enough to show this change on a clinical level. But yeah, it's something that we're still investigating. So
Yeah. On the topic of, a lot of the times in the literature, when we talk about psychedelics or entheogens, in the literature you see that you hear this term set and setting. And I'm curious, in the ayahuasca paper that was published, did they measure the setting? Like, it was in a ceremonial setting, we heard, but was it done, like, was it done in South America? Was it done like on a reservation somewhere? Like, where was the location of that? And did they incorporate the set and setting in that particular paper?
yeah, so that particular data, I should have mentioned it. It's data from ceremonial ayahuasca users in South America, and I believe the data is coming from 5 different retreats in South America. I'm not entirely sure what retreats, because I didn't actively participate in collecting this data. But yes, it's been done in ceremonial settings in South America with a proper, shaman or curandero. And yeah, whether the set and setting is a moderator of the experience and perhaps mental health outcomes, it's very difficult for me to say. And I think the research is currently being done about set and setting. And also, it's so much different to how we conduct trials and in the UK or in academia, where set and setting is completely different, But if you can picture yourself as for example, if I can picture myself as someone that is coming from Western world with some significant traumas, going to the jungle and going through the whole experience, I'm not entirely sure whether this experience being so different from the idea of the world I currently have, which is, in the jungle, would be extremely helpful in me integrating this experience. But again, I'm not definitely an expert on that matter, and my research is mainly, clinical. So I could tell you a lot more about the settings we have in our clinical trials in London. But it seems that, those people seem to improve. So yeah, I'm not entirely sure how the setting in Amazon moderates the outcomes, the mental health outcomes people have, but it's definitely interesting to look into.
Yeah, it would be a cool study. When you look at a lot of talk therapy, or when I read some biographies of people, from some of the things that I have read, getting leverage on yourself and is like a big step in changing. And I would imagine that gearing up for a trip to a different country to experience a whole new culture is a giant step in getting leverage on yourself. It's really saying to yourself, I want change. I'm taking this next step, which is a big part of any sort of healthy dynamic of whether it's relationships or family or friends. And it's really a fascinating concept to think about. And I'm all for people finding ways to take that next step or harness the courage it takes to become their authentic self. It's really wonderful to think about that aspect of it. And
Absolutely.
I'm sorry.
No, absolutely. I agree with you. And I think like even taking this big step and going for a trip to, Amazon, it's kind of an intervention in self. So it might be a significant confounder, but as long as we don't cause harm and
Yeah.
there are some benefits, I don't necessarily think it's a bad thing.
If I were to wave a magic wand and be able to fund any project you wanted, like what are some projects, like if you had the ability to have, if I was a giant backer and I had tons of money and I could fund whatever project you wanted to, would there be a set of projects or would there be one in particular? What would it be?
Wow. First of all, if you do have those magical skills, please do. Please. It would be absolutely amazing if you could. Oh, it's an interesting question. It's hard for me to kind of choose just like focus on one project.
Right.
There are so many interesting research questions, in my opinion, and um, I, I think if I were to choose, I would probably focus on kind of, finding the right biomarkers of mental health and physical health, because I don't think we currently have enough reliable biomarkers to kind of investigate the improvements in plasticity and, in the physiological and psychological well-being. So I think it's quite important to mention there is also a huge translational gap between animal models and human clinical research. As you know, the mechanism of action papers are mainly focused on animal models or cellular models. However, the methods we currently have are not entirely translational to humans, and also sadly it's really hard for us to investigate what's going on in a human brain on a very kind of molecular level, because the only way we can do it is using brain imaging, which is typically quite expensive. If you want to use PET imaging, that gives you an indication on the receptor level. The cost associated with investigating any working hypothesis are just humongous, and I think that's a big limitation because, as you know, everyone is different. So to kind of really have a good understanding and prove your hypothesis, you need a large sample, but you cannot enroll too many subjects on a study that is extremely expensive because you have those financial constraints. So it's definitely a very tricky field to kind of, operate, to try to be as translatable as you can, but also focus on the high cost of the methods. And yeah, I think it's definitely good to investigate.
when you say biomarkers, I'm familiar with the loss in translation from like rats to humans. Like they have like the head twitch and they cut off their heads and they look at all that kind of stuff. Like obviously can't do that with the human. But when you say biomarkers, I don't know what that means exactly. Is that like different levels of serotonin, or is that different? Like what does it mean, biomarkers? Like what specifically would you be looking for?
Yeah, I mean, it really depends. So biomarker as a variable that you can use as a working hypothesis to test a certain, for example, trait, or to test a certain kind of improvement in physical or mental health. For example, we could say that BDNF is kind of the biomarker we use to test a neuroplasticity. However, there are also limitations surrounding this biomarker. So I think the field is still constantly developing, and I think we need to test more of those biomarkers, not only of neuroplasticity, but just as an example, BDNF is a biomarker that we can test both in animals and in humans. However, while the way we test it in humans is typically from your peripheral system. So like by taking the blood samples, because it's not extremely expensive to do. It's kind of doable to kind of take a blood sample from participants and test the levels of BDNF in periphery. However, neuroplasticity is a process that occurs centrally in your brain. So if it's a good enough biomarker to test from periphery for a process that happens in central nervous system, it's a bit of an overstatement in my opinion. And also different interactions may also affect the circulating levels of BDNF in your plasma. So it's extremely tricky to find the right ways to measure our working hypothesis still. So I think there needs to be a lot more research done in humans. And yeah, sadly, to do it, it's quite expensive. So, for example, focusing on heart rate variability as a biomarker of, perhaps improvement in depression, which we still don't know if it's an actually good biomarker, it would be great because it's completely non-invasive. It's not expensive to test it. You can either test it using the Oura Ring as we do, or any sort of wearable seems to measure heart rate variability with enough accuracy to kind of, see a difference within you as, perhaps non-clinical subjects. So it would be good to find more of those kind of cheap and reliable, biomarkers that could help us assess the improvements on both mental and physical health.
It's fascinating to think about. In a previous published paper, I think you spoke about the geometric shapes of plaque in a while back, and I only scanned through that paper a little bit. But what is that? What does that geometric shape of that plaque tell us? Like, why is that important?
Wow. So it's something that I did so much earlier in my career. So basically, maybe to give a bit of context, because it's a bit out of the context to talk about plaques that happen in the cardiovascular system after talking so much about psychedelics. So before working in the psychedelic field during my undergraduate studies, I came across that research group that does a lot of bioengineering and working with, cardiovascular system. And my supervisor was kind of investigating. He wanted to focus on investigating potential risk of people having an acute cardiovascular events in a non-invasive way. So what we did, he's using a 3D modeling software applied on some cardiac computed tomography of the heart to first of all extract the vasculature of the heart. So it's called coronary arteries. Like all of our hearts have some arteries and little veins around them. And what happens in people that have a coronary artery disease is that some plaques are forming in those arteries. So for some people, it might be stenotic plaques. That means they are mainly form of fatty tissue. For other people, it might be more of a calcified plaques. So typically, to investigate in a clinical population, if someone has a potentially coronary artery disease, the methods that are being used are kind of invasive and involve putting a catheter inside of your artery, which again has a higher cost because you need a qualified clinician. Again, it's invasive. It's not a very nice procedure. So we thought maybe we can approach it in a different way and use this 3D modeling software to kind of extract the arteries. And so the first step was to extract the models of the coronary artery trees of, I think it was 27 images I had at the time. And then the next step was to extract those plaques from those arteries. So it's a bit of a challenge because how we see it on the computed tomography might not be extremely accurate as you would see it with the contrast inside of your vein. So I try to develop a method on how to kind of visualize those plaques in a non-invasive way in people. So then the next step would involve to kind of extract the plaque itself and measure the geometric properties of this plaque. And my supervisor, who's also a brilliant scientist, has a lot of computational background. So he applied his knowledge to kind of develop an algorithm that would help us perhaps predict a chance in the future of someone having an acute cardiac events based on the geometric properties of the plaque. And he does similar research in people that might have a risk of stroke. So also by measuring the angles and the geometric properties of the vasculature in the brain, you might be able to predict a risk of a stroke in the future. So again, I think it leans nicely into the conversation about trying to find non-invasive biomarkers to kind of perhaps diagnose people and help people, because it's such a unmet need, and now we have such a sophisticated computerized technologies that might help us to diagnose those people much earlier. Because if you have a method that is definitely much cheaper and non-invasive, there is a greater chance of getting someone tested a bit earlier than after it actually happens, when typically it might be too late to improve in general health outcomes than if it would be if you were tested much earlier. So yeah.
It's so fascinating to me. And might it be possible to use that algorithm or that research in some of the things you're doing now? It sounds like he has found a way to take this 2D model on screen and verify it by all the research. You know what I mean? Like in some ways okay, here's what it looks like on the screen, and here's the tools we're going to measure it. I don't know. It just seems to me like he's figured out a way to translate this two-dimensional object into reality. I mean, that probably has a lot of repercussions in other research and stuff like that. It's fascinating to think about. I'm so stoked to get to hear people talk about it. It seems like it's going to be, in those findings, did they match up? Did the computer model that you saw on the 2D screen, when you measured it afterwards, were they similar? Was the geometric shape the same?
So there are definitely some limitations with this research. First of all, the models I've done were only based on the CCTA images, and we didn't come back to those patients and actually measure the properties of those plaques using different methods. It's something we postulated as a potential potential tool that might be used in the future if we do much more research, but it was not exactly verified in that population sample we tested. It was more of a retrospective assessment and trying to come up with a method that might be potentially used. And it's also important to mention that most of this research is happening in Asia. I believe I think it's China, so I'm not entirely sure whether the clinicians did any follow-up with those patients and what would be the long-term outcomes of those patients that we measured. However, I do think that there is a potential trend of moving the paradigm to a more personalized and perhaps cheaper diagnostic medicine. That I think would definitely be very interesting to investigate more. And we just have to be, creative, and we have to be kind of, adventurous and open-minded. So I quite like taking that direction of making something accessible to as many people as you possibly can, if that can potentially help those people and it's accurate enough. But again, it takes a lot of time and it takes a lot of funding. So sometimes we start doing those things and this research, but never end up, having any conclusive findings because the sample is not big enough to show statistical difference, or it's too hard to come back, or, the grant is ended. Yeah, it's just really tricky to navigate academia.
That's a lot. I didn't know that. And I'm willing to bet most people don't ever see that side. Like there's all this promise of a study that gets done, but then it never gets revisited. Like that's kind of heartbreaking in some ways. It must be difficult to look at that from that perspective. And
Yeah, absolutely.
man, I think creative, adventurous, and open-minded are all three great words that describe you and the work you're doing. Like I'm super thankful for all your time today. And I really enjoyed it. I'm really excited that people are out there looking for answers to problems and questions and are excited to do it and are at the forefront of it. But before I let you go, maybe you can talk about where people can find you, what you have coming up, and anything else about the microdosing study that we didn't touch on.
Okay, well, I'm not a huge social media person, so I do use LinkedIn quite a lot.
Sure.
I think it's a really good platform because it's professional enough and there are still some, boundaries. So I quite like to use LinkedIn, and I'm open to anyone who's interested to have a conversation about microdosing or psychedelic research to reach out. So please do, if you are interested or would like to ask me any questions. For people that might potentially be interested participating in our microdosing study, we do have a sign-up link on the Imperial College website. So if you simply type in microdosing 2.0 Imperial College London, you will come up with the website on Google, and then you can read all the information you need. And I would strongly recommend reading the participant information sheet and the inclusion criteria before you decide, starting the trial. And what else I have coming up? So mainly the coordination of the trial, which I hope will be fruitful, and also hopefully some workshops soon. I might do some presentations about microdosing again, and some of the sexuality and female targeted research. So I will definitely let you know if there is something coming up in the near future.
Yeah, we didn't really touch on that. Is that something you want to talk about, the female targeted research?
I think we might be running out the time right now, but
Me too.
I would definitely love to talk about it more in the future.
Absolutely. Well, everyone listening, go check out the show notes. Check out the work she's doing. It's really incredible. And I had a fantastic time talking to you. Thank you very much for your time. Ladies and gentlemen, hang on, Aleksandra. I'm going to talk to you briefly afterwards, but I'm going to hang up with the people. Ladies and gentlemen, thank you so much for spending a little bit of your Sunday with us. I hope the rest of your Sunday is beautiful. And that's all we got for today. Aloha.
Thank you.